Hi, this is Dr. Rob. I want to mention just a couple tips with the denneroll. If you're using denneroll, or if you're using Dakota traction, with the denneroll, the way that you can use these, optimally, we want them done twice a day for 10 minutes. That's with all the other things you're going to do. So I like to get it when your body's warmed up would be best. But if you really have a time crunch, the best thing is that, let's suppose, like for example, for myself, in the morning I always do my denneroll in the morning. So my 5:20 alarm clock goes off, I press the snooze button, I roll out of bed on the floor, which is really my bed, and then what will happen is then I'll just pull this thing in and I'll put it on there, and I have 10 minutes before the snooze button goes off, and then I'll go ahead and I'll be doing my denneroll and my tractioning for my neck. Remember, it's real important because we want to get that curve back into the spine for the long-term basis. So the repetition of that is huge. So then once again, right before I go to bed, it's going to be, I'll put that in there, and it'll be 10 minutes right before I go to bed, then I'll kick that out, roll over, and I'm in bed, and I can go to sleep. So you want to just get it placed. Some people will have a high placement, some will have a real low placement, and some are right in the middle. So it's real individual depending on where your placement is on your x-ray. Now, there is an area here that says shoulder. You want to make sure this area that says shoulder goes down towards the shoulder side. So we'll go like this. Now when you do it, you're going to get it comfortably in place. Now I'd like people to go ahead and bend their knees while you're doing this and open up their chest. Just take deep breaths and let it go. Now for those of you that want to do an extra work, there's one more thing I can give for a tip, is you can do tilts and hulas. The tilts and hulas, basically all you're going to do is you're going to draw the belly button in. You're going to just do little tilts so your spine is arching off the ground, so your pelvic's coming up and it's flattening. And it's not so much of a power move, it's just really a motion. So you can keep motion in the lower spine as you're doing this. You go with flexion extension, just make sure you keep the belly button drawn in. So you can do the flexion part. And this is just like we're doing it on the wobble chair. Then you can do the hula part. You do hula where this pelvis is going to get closer to the rib cage, and you just alternate that. Then you can go through that. And the last one, what you can do, and some people can do this, is just to rotate the lower spine over as you're doing this. Keep the knees together, rotate over. Just make sure that your head stays neutral. And those are all motions that you can add in to the denneroll. So when you come up off the denneroll, you always want to assist your head. You pull this out for a moment, and as it settles down, you can just gently get some slight rotations from side to side, 5 to 10 times. Then come back up, help yourself up, roll to your side, push yourself up. And that's some tips on denneroll.